Thank you for calling Oglala Lakota Air Rescue. This is Daniel. How may I help you?
Hi, Daniel. This is Lacey with Rosebud IHS Hospital up here in Rosebud, South Dakota. We have a patient that's needing transfer to Monument Health in Rapid City.
Okay, well, we can definitely assist you with that, Lacey. So just confirm me, you have a patient there at Rosebud.
The day I was injured, it was towards the end of my shift. Me and a couple fellow officers were getting a workout in before the end of the day. I was doing bench press. I was lifting 315 pounds, and the bar just slipped out of my hands and landed on my chest. I remember it hurt really bad to breathe. Every breath was earned. It felt like a knife was being stuck in my chest every time I took a breath.
The weight that fell on him did fracture his sternum, and it put a hole in his heart.
There's not very many times that you get to stand in the doorway and just kind of like immediately know what's going on, but that was one of them.
As we came around the corner, we saw Thomas there laying in the bed in obviously excruciating pain. He didn't look like he was doing very well at all. And at that point we knew that our best thing to do was to get him loaded up and get him to the helicopter as fast as we could.
I remember being wheeled into the operating room. Initially I thought maybe I just broke a rib. I didn't know it was like that severe. But when I seen that amount of doctors fully suited up and locked in, I knew that it was more serious than just a cracked rib. Once they put the gas on my nose, I remember I kind of had a sigh of relief. It felt like my fight was done. Like I didn't have to struggle to breathe anymore, that it was in these guys' hands now, and I felt like I was going to be okay.
What we did was what we call a median sternotomy, meaning we had to open the breastbone to get access to his heart. And so there's a lining around the heart, the pericardium, and because he was bleeding, that tough lining was compressing his heart. And so that's ultimately what would have killed him.
Not knowing how bad his injury was and knowing it now, if he would have had to have been transported by ground, the outcome could have been drastically different.
When he came to us, he was as close to death as one could be. And so the reason he's alive has a lot to do with all the medical teams that were involved in his care, but it really has to do with the team that saw him in the emergency room, making that phone call, and by the grace of God, having your flight crew there to just bring him to us immediately. Another 2-3 minutes, he wouldn't be alive.
They saved my son's life, and I want to thank them. I want to thank everybody. I'll say prayers for them for the rest of their life, for the rest of my life. I love them.
God bless you. And we love you. Our family sure appreciates everything.
He told me, he's going to be able to walk his daughter down the aisle. And it puts it in perspective what you're doing and what your team is doing that day for somebody.
It's an absolute honor to be able to take care of Thomas and patients like him.
I think it reminds you of like why you do this work and everything, and it's important.
If it wasn't for all of them being professional and responding in a timely manner, I probably wouldn't be here today. So I'm definitely thankful that, everybody is good at what they do.